So there's a lot of material to cover. I'm going to go fast because I don't have that much time. But stem cell therapy has been shown to have anti-aging benefits. So this is not a theory anymore. This has been used in practice, and I'll show you the evidence. So we're all seeking the optimum in our function. And what's causing our decline? The root cause is actually the aging process. That's the disease, that's what's happening in disease. Even in something like osteoarthritis, is not a wear and tear disease, it's actually an inflammatory process. All right, so when we think about damage, and that should lead to repair, right? When we were little kids, things are repaired rapidly, and no one has osteoarthritis, 对吧？关节炎没有这种慢性的关节炎。But when we get older, what's happening? We cannot keep up with the demand, right? Our repair is not keeping up. So what's causing the aging process? You know, why when we get older, things are so much more difficult? We have different mechanisms, but eventually the final downstream effect is that there's exhaustion in stem cell supply. If you have stem cells, then you are going to replace the damaged tissue. Now you're fresh again, but if you can't keep up, then you stay with damaged tissue. So that's a final denominator. And what happens when we have disease? And what is the aging process? So I think of it as a burning building, that when things are accumulating, you know, disease is brewing, the building is going to catch on fire. But before the building catch on fire, 在着火之前，对吧？你看不到是里面有疾病，你不知道它里面是做什么。但等烟冒出来以后，你已经有疾病了。The burning that's going on inside the building. So how do you calm this burning inside the building before the smoke comes out? So that's the inflammation and aging are so tightly connected together. That's why it's coined inflammaging. So even when we are healthy but older, our inflammation markers are elevated. And that leads to all kinds of age-related diseases. And there's elevated inflammation marker. Let me see, yeah, inflammation markers are increasing like IL-6 and CRP. So even if you look great and you're exercising, you're doing marathon, I'm sorry, your inflammation markers are still high. And aging can lead to different problems, right? So like bone marrow, when you have a decreased bone marrow supply of stem cells, there's also a different differentiation potential of these cells. And that when you transplant young cells, that actually can lead to rescue of the bone loss and then delays aging. What's interesting is that the aging of MSCs, it's detrimental to multiple organ systems. And when you transplant these MSCs, they can, even if you just put it under the skin, right, 在皮肤下面注射这些干细胞，就可以挽救很多有关age-related degeneration. So when you have aging process, 它给你it decreases therapeutic potential of MSCs, and it's not just when we're getting older, it's also when we culture the cells for many generations. You've all heard about people growing the cells to a huge number. You think that, oh, the more I'm getting, the better it is. No, actually, the cells are aging. The more you grow it, the more they age, the less the potentials are. So that's another aging process, is by allowing the cells to grow in the culture medium. And some basics on stem cells, especially MSCs. So, of course, you know we all came from stem cells, right? We each came from a single stem cells. 卵子受精的卵子就是咱们第一个干细胞，对吧？咱们都是从干细胞一个干细胞这样来发展成了这样对吧？了不起的一个人体。So when we age, the number of stem cells will decrease. The number of MSCs 和它整个身体里面细胞的比例，对吧？从你刚出生到10几岁到40岁、80岁，你看它的比例从1到1万 1到10万，然后到你40岁就变成1到40万，至到1到200万，就你到老的时候，你就没有什么这样的 MSC 这个 mesenchymal stem cells， 这是一个很主要的这么一个干细胞。So 我们就是越来越缺少，就越减少了咱们的活力。This is a graph that can show you the sharp decline, right? Falling off the hill, the cliff. And that's how much MSC we have when we get older. What are MSC? So mesenchymal stem cells 这个间充质干细胞，它们就在这个血管的岩壁，在这周围，在这等着你，对吧？每个人身体里面都有这些无数的干细胞，但是越来越少，它都在你的血管，在你那儿潜伏着。如果你一旦有什么需要，马上他们就会把自己挤进去你的这个血管里面，然后去找你的信号，找到什么地方有让你需要救助的这个信号，它再把自己挤出来，然后到那儿再去发泌各种各样的生长因子啦，各种各样的信号外泌体啊，然后来帮助你身体修复。所以它是一个很奇妙，它一个帮助整个身体来修复的这么一个总体像总指挥一样。所以这个是一个非常重要的一种细胞。这是它的这个照片。然后呢，它有什么作用呢？有各种各样的作用。So anti-inflammatory, right？ 抗炎症。对 immune system 的 modulation 它的改善，然后 regenerative 这样是新增进它增长新细胞，可以增长你的这个blood vessel 你的血管的形成，然后呢还可以帮助你减少你的纤维化，然后anti-apoptotic will rescue cells that are dying, but pro-apoptotic, telling the cells that don't need to live, like cancer cells, tell them to die. Antimicrobial, actually killing off microbes that don't belong. And then mitochondria transfer is my favorite. It actually can transfer fresh, new, healthy mitochondria, 对，线粒体，对吧？健康的线粒体，把它给输送到你的细胞里面。所以它有各种各样的功能。所以为什么我对外泌体，虽然我也用，我也喜欢，但是它不是 end all be all。那个它利用外泌体来产生这些功能，但并不是说外泌体自身就可以这样，是细胞有细胞的叫智慧智能，所以这个是非常重要的。Young versus old， 老和年轻就是不一样，对吧？Does age matter? Lifelong perseverance. So MSCs will stay in your body your whole lifetime. 这样呢，它也就会积攒了很多的 cellular damage, accumulation cellular damage, and that can lead to disease and including cancer. But young MSCs, 对啊，从婴儿身上这样，从很早的这个 MSC 来源就没有这些可能性。就为什么我说这个 age matter？ 因为比如说从脂肪提炼的提取的这个 MSC。它就是如果想让它去治疗你的皮肤的恢复的话，它的效果就差了很多。你从你的血浆你的 bone marrow derived MSCs， 它就制造你的肌肉的这个能力就下降了。然后这个 bone marrow derived MSCs also has age-related decline in the inflammatory response. And that's very important in how the MSCs work. They need to migrate, they need to be activated, and they need to exert their function. But the older you are, the stem cells from your own bone marrow, the less capable they are. And also, there's genetic changes. So 在你基因方面也有变异. That's also declining. And age also affect their ability to form new blood vessels. And they also, when you have aging bone marrow derived MSC 在骨髓里面的那个你的 MSC 里面，它会积攒这些reactive oxygen species， 不仅是它增长了这些自由基因，它同时还对这个自由基因非常的敏感，它容易被受伤害。So it's double whammy, right? When you use young MSCs that outperform older MSCs. 这个是在心脏方面的修补 cardiac parameters after heart attack. MSCs from young individuals can undergo neuroectodermal differentiation to form new neuronal tissue， 对吧？大家都想恢复大脑，这个能帮助你更加恢复大脑。你要是老一些的 MSC， 你会差一些这些功能。And also we know, because MSC stay with us our whole life， 这些间质干细胞在咱们身体里跟咱们一辈子，对吧？这一辈子，那它就跟咱们一辈子，你做了什么，吃了什么，接触了什么，它都会受影响，包括很简单的这种抗痛的这个药物 NSAIDs， 其实大家都很常用的，对吧 ？ibuprofen 这种抗痛这个消炎药，它都会影响它的功能，所以我就不太细说。然后 lifestyle factor, high fat diet can affect MSC's ability to differentiate. Obese patient, their MSCs also are impaired. Diabetes also causes problems. I know China has huge diabetes problem. 200 million people with diabetes. I mean, that's crazy. That's almost the entire U.S. population. That's 2/3 of the U.S. population. That's an epidemic. So all those people, their MSCs are impaired. Aging leads to decreased bone marrow MSC supply, and then their ability to rescue bone is declined. And so this, I think we went over this. So how can stem cells combat the aging process? We have seen, there's some evidence I want to show you. In a rat model, traumatic brain injury, the IV infusion, 的静脉注射的 MSC can decrease inflammation of the inflammatory cells presence in the brain. And in rheumatoid arthritis and lupus patients, 这个是比较大的study, 172 patients, and MSCs, so allergenic means it comes from another person, usually from a younger source. It helps reestablish balance of the immune system. And in patients with ankylosing spondylitis, so a spine disease that's inflammatory, that also help decrease inflammation markers and decrease disease activity. So as you can see, the inflammation and the disease are connected. And then also some other evidence. So I want to just go past this real fast. I want to present you this evidence. This is really interesting study. When we age, our cholinergic and dopaminergic systems are declining. So that controls our muscles, our brain, right? These are important neurotransmitters. And aging can cause exhaustion of stem cell population, and aging also reduce neurogenesis in muscle in the brain and muscle atrophy, and accumulation of toxic waste product and exhaustion of stem cell population. So when we give adipose-derived stem cells, that can reduce certain deficit in memory, including increased neurotransmitter and increased brain-derived neurotropic factor and some other growth factors. So there's various benefit in using mesenchymal stem cells. So this experiment is really interesting. So this is a middle-aged rat, 10 months old. When they give them either control or stem cells from either amniotic stem cells or adipose-derived stem cells, they were able to give these rats intravenously, and they showed improved cognition and physical function. And when the rats reached 20 months of age, so that's very old, 很老的这个老鼠，只有30%的这个 control is still alive, but 70 to 100% survived in the treated group. By 23 months of age, all the rats in the control group, so they did not receive stem cells, they have all died. But still, 60 to 72% of the treated group are still alive. And a lot of the cells actually differentiated into neurons, which we all like, right? We all like brain regeneration. So when they measured all these factors, brain-derived neurotropic factor, muscle neurotropic factors, and so everything they were looking at, how much blood vessels there are, everything was restored to the level of the young rat. So not only they have they have higher function when they measured the levels of these neurotropic factors. They're looking at what's going on in the cells, but they're actually, cellularly, they're actually functioning as younger cells. And tissue injuries were reduced, and monthly infusion of these cells improved their stamina and cognitive function. So everything was restored. So this is evidence that, that functionally and cellularly, we're actually reversing the age of these animals. So there's another experiment, which is really interesting. 15 months of age. So this is old. That's human age of 75. 就是这个人的75岁的寿命. Giving these rats from mice young stem cells from younger mice, age 3 to 15 weeks, that also improved their function. Improved their maximum lifespan, increased by about 31%. So life extension. 然后就是from the time they got the experiment until the time they died, that period of time. So that's a basic scientific evidence. So I'm not going to talk any more about this. I'm going to stop here, but hopefully that gives you a glimpse of what's possible. Okay?
Thank you for the sharing. We have only one question.
So thank you, Dr. Kong. My question is, could you please simply introduce what is the specific process of stem cell therapy? Like, do we need to simply inject the stem cells, or what else do we need to inject at the same time? And how long do we get one injection? And does it have to be a unipotential stem cell, or a multiple potential stem cell, or totic potential stem cell? Yeah, simply. Yeah. That's my question.
Right now, the most popular form is the mesenchymal stem cell I'm talking about, because it's so easy to use, and it is a kind of a generalist. It's not going into your body. It's not. It is forming some new tissues, but the majority of how it works is by sending signals so your body can be woken up and make new cells in different organs. So it doesn't have to be making new tissue in each organ, but can just tell your body to make new tissue. So that's an overall awakening of the body. So that way we can just give simple IV infusion, 静脉注射, and then we can tell the body to start recovering. Of course, science is evolving. We can have more powerful cells later on. I'm hoping to use a person's own cells and get them back into the embryonic state. And maybe that's the holy grail. But right now, we're seeing incredible successes just from these mesenchymal stem cells. And what I've done in the clinic is regular IV infusions every 3 to 6 months. So I've done that myself for the last 9 years. So I've done it every 3 months. So you are reducing your biological age every 3 months. Yeah, so that's where we're at right now.
So the main method you mentioned is to do the 静脉注射, yeah, and 3 to 6 months for one injection.
Yes,
Thank you.
We can target different tissues as well. You can always deliver more concentrated stem cells into a particular location, right? Like a joint, a face, the penis, vagina. You can do all that, but just by IV infusion alone, 光是静脉注射就可以达到极大效果.
Oh, thank you.
Thank you. Thank you for the sharing.